Hey everyone, welcome to my YouTube channel. I am Dr. Farrukh. On this channel, I will be sharing you the clear, simplified and detailed explanations of topics from pharmacology, pathophysiology, clinical medicines, and in the future other medical sciences as well. Since this is my first video, that's why I'm starting with one of the most important branch of medicine, which is pharmacology. Why I'm starting from pharmacology? Because most of medical students find this science difficult, but you don't worry, I'm here to change that perceptions. I will try my best to make all the topics of pharmacology like eating piece of cake. Well, in this video now I will be discussing about introductions to pharmacology, in which include what is the meaning of the pharmacology and why the pharmacology is an important branch of medicine. And at the end I will discussing about the branches of the pharmacology. Let's get started the topic. So as I told you, in this video I will discussing about introductions to pharmacology. It means we should to know what is the meanings and what is the simple definitions of the pharmacology. So in order to know about the meanings of the pharmacology, you have to know about from which word it derived, the words of the pharmacology. The word of the pharmacology derived from the Greek word pharmaco, drug, and logia, science. Here I will write pharmaco, drug, and logia, what, science. So from the meanings there is the simple definitions. Pharmacology is a science which study about the drug and their actions in living organisms. It was the simple definitions of the pharmacology which we can make from the meanings of the pharmacology. So now here for all of you questions arise why the pharmacology is an important branch of medicines. The reasons behind of it is this word. What is this word? It is drug. What is the drug? Drug, it is the life-saving materials in which the doctors can prevent, manage and treatments of the certain diseases. So now, except the drugs, the pharmacology, by the help of the pharmacology, we can study about the correct dose of the drug, the indications, contraindication and side effects of the drug. It was why the pharmacology is an important branch of the medicines. Now it is the time to discuss about the branches of the pharmacology. So the branches of the pharmacology, for to know about the branches, once again I will repeat about the definitions. If you are the students who now starting to study about the pharmacology, I will advise for all of you, you should to focus on the definitions, because now here I will tell you now the branches of the pharmacology. In order to know about the branch of the pharmacology, first of all, we have to know completely about the definitions of the pharmacology. So pharmacology is a science study about the drug and their actions in living organisms. So here, according to the actions of the drug in the living organisms, there are two major groups of the pharmacology. The first major group, it is the general pharmacology, which is in my right side, and the second one, it is the systemic pharmacology, also known as private pharmacology. So now you have to know about what is the difference between the general pharmacology and systemic pharmacology. The general pharmacology is about the basic principles of the drug actions, but the systemic pharmacology is about the drug individual or the classes of the drug in detail. Now first I will cover about the general pharmacology, then after that I will continue about the systemic pharmacology. So now about the general pharmacology consists of the three main components: pharmacokinetic, pharmacodynamic and pharmacotherapy. Once again I will tell you, the general pharmacology is about the basic principles of the drug actions, which consists of the three main components: the pharmacokinetic, pharmacodynamic and pharmacotherapeutic. So about the general pharmacology, pharmacokinetic, pharmacodynamic and pharmacotherapeutic, I will make a separate video, but in this video now briefly I will explain you what is the pharmacokinetic, what is the pharmacodynamic and what is pharmacotherapy. So it are the components of the general pharmacology. So pharmaco, drug and kinetic word from the physics, you should be familiar about this word. Kinetic movements. So it means the movements of the drug to achieve its actions. This process occurs in the pharmacokinetics, which is the first components of the general pharmacology. So by the common definition, we can say in the pharmacokinetic, what the body does to the drug. What the body does to the drug. Later I will come to this word. So the second one is pharmacodynamic. Pharmacodrug and dynamic what power from the physics also. From the physics. So dynamic power or action, it means there is mechanisms of the actions of the drug. And the last one is pharmacotherapy. For pharmacotherapy, it is how to correctly prescribe the medications. So now let's start from first to talk about the pharmacokinetics, then pharmacodynamic with the pharmacotherapy. So the pharmacokinetic, as I told you, it is the pharmacodrug, and kinetic, the movement. The movements of the drug to achieve its action. That is the common definition for the pharmacokinetic. It means what the body does to the drug. Here I will write you, it is the common what the body does to drug. So here it is what the body does to the drug. What our body does to the drug. Our body does to the drug absorb, distribute, metabolism, and excrete from the body. These are the stages of the pharmacokinetic: absorption, distributions, metabolism, and excretions. So now I will explain you about each stages. About the first, I will start. We should know about the absorptions, how the absorption occurs. But before the absorption, you should know about the administrations of the drug. There are two main roles of the administrations of the drug. It can be enteral and parenteral. Enteral, it is the types of the administrations in which the drugs can be given through the gastrointestinal tract. Can be peros, which is orally, can be transbuccal, can be sublingual, and rectal. These types of enteral types of administration has the slow actions, but it is safer. But the second one, it is parenteral, which is the immediate, which has immediate action, but it is more dangerous or not more safer than the enteral types of the administrations. So to the parenteral include intravenous, intraosseous, intraarterial, subcutaneous, intradermal, and etc., which has mediate action, immediate types of the mechanisms of the actions. The drugs can be given through the injections and infusions. Now after the administration of the drug, the pharmacokinetic will come. Which stage of the pharmacokinetic? Absorption. Here I will bring you examples. I will bring examples with one solid dosage drug, especially the tablets. For example, here it is one tablet. This is one tablet. So when we take it enterally, once again I will repeat, it is types of the administration in which we give the drugs through the alimentary tract, which start from the mouth and finish with the end with the anal parts of the rectum. So now these drugs, when we take peros through the mouth, it comes through we swallow from the mouth by the tongue to the where? To the pharynx, from the pharynx to the esophagus, from the esophagus to the stomach. In the stomach, when it comes, here we have the pills, we have the tablet. So these pills or solids must absorb to the blood circulations, but it is the large particles. It must be in the forms of the liquids. That's why it undergoes the several stages. The first stage, it is called disintegration stage. This disintegration stage, these large particles break down to the smaller particles. So now these smaller particles, this process is called what? Disintegration. This disintegration occurs under the actions of the contractions of the muscles of the stomach, under the peristalsis of the stomach. So when the disintegration occurs, as we know, in the stomach there is what? Gastric fluid. These small particles will be dissolved in the gastric fluid. And be converted to the fluid. Then it can be absorbed to the blood circulation. Now this process is called disintegration, and this process is called what? Dissolutions. So there is several groups of the drugs. Some groups of the drugs absorb from the stomach, from the acidic medium. Some of them they will absorb from the intestines, small intestines, from the basic mediums. It is dependent on the pH. As I told you, I will make separate video about the pharmacokinetic, pharmacodynamic, pharmacotherapy, more detail in the separate video. Here briefly I will explain you. Here the some drugs will be absorbed from the stomach from the acidic medium, some drugs absorbed from the intestine from the basic mediums. So now we have the drug in the forms of the fluid. The drugs becomes disintegration, dissolution. This process, these stages can be occurs only in the solid dosage form, like the capsules, drugs, and pills, tablets, and granules. We don't have in the other types of the administration, like in the solution, especially intravenous solution or infusion. We don't have these stages because here that drugs, for example, infusion directly reach to the where to the blood circulation, but here for example tablets, in order to reach to the blood circulations, it must be in the forms of the dissolutions. That's why there is low bioavailability for the pills or tablets, less than the infusions or injection types of the solutions. Now we have the drugs in our stomach or in the intestines in the forms of the solution. So this drug will be transferred via to the blood circulations. We have the drug in the blood circulations. Our drug reached the blood circulation, the bloodstream. Now what is the name of this process? You should to know this. The name of this process, which is the first stages of the pharmacokinetic, it is absorptions. It means what is the absorptions? It is the transference of the drug from the sites of the administrations to the blood circulations. It is called what? Absorptions. It is the transference of the drug from the where? From the sites of the administration to the blood circulation. So it was the first stages of the pharmacokinetic. Now we have the drug in our bloodstreams. So when it reaches the bloodstream, the drug, it goes where? Towards its actions. This process is called what? It goes towards its actions. This drug goes towards its actions. Sites of actions. Now the goings of the drugs from the blood circulations toward the sites of the action, it is called what? Distributions. It means the drug distribute towards the sites of the actions. Distribution. So how the drug distribute? How it means the drug can find its sites of the actions. It is dependent on the types of the receptors where we have problem. For example, if I have the headache, I have the pain in my brain, I take the analgesic drugs. This analgesic drug, when it reaches to my bloodstream, it goes to the tissue of my brains in order to eliminate my pain. If, for example, I have the intestine or stomach problems, the drug goes to the intestine or to my stomach in order to eliminate the violation functions of that organs. So it means this process is called distribution. So the transference of the drug from the sites of the administration to the blood circulation is called absorption. From the blood circulation towards the sites actions, it is distributions. So now this is where the sites of the action. In the sites of the action, the drug performed. The mechanisms of the actions of the drug occurs. In the sites of the action, mechanisms of the actions of the drug occurs. What is the name of this process? Mechanism of the actions of the drug. Pharmacodynamic, which is later I will explain you. Don't forget about this. So it is the mechanism of the actions of the drug. Now the drugs came already to its tissue and provided its functions. Now the drugs again when it provides its actions, again it comes where? To the blood circulation. Now we have again these drugs in the blood circulations. Now we don't need two drugs. Our body must remove the drugs from our body through the excretory organ, which is the kidney, under the actions of the nephron, which is the functional units of the kidney. So, but the nephron has one property, the glomerular filtration barrier, which consists of the fenestrated capillary, glomerular basement membrane, and podocytes, which is responsible For what? For excretions of the water soluble substance. But the drugs, the most drugs is lipophilic. It means hydrophobic drugs. Hydrophobic. It means there's no soluble in the water. That's why the kidney cannot excrete what? Cannot excrete these groups of the drug. These are non-polar. Non-polar. It means not soluble in the water. That's why in order to excrete through the body, it must be polar. Now it must be polar. Where it can be polar? Of course, in the liver. In the liver. Non-polar drug convert to the what? Polar. It means not water hydrophobic to the hydrophilic. Convert of the hydrophobic to the hydrophilic. Then when the drug becomes from the converting of the hydrophobic drugs to the hydrophilic drug, this process is called biotransformations, which is the metabolisms of the drug occurs. When the drug becomes the polar, we have the polar drug. Then again it comes where? To the blood circulation. Then easily it can what? Excrete through what? Through our bodies by the urine. It was the main process of the pharmacokinetic, what the body does to the drug. It was this concept. So now let's go to talk about the pharmacodynamic. Pharmacodynamic, pharmacodrug, and dynamic what? Power or action, the mechanisms of the actions of the drug. We have also the same definition with the pharmacodynamic, which is vice versa, which is opposite to this one. What the body does to the drug, it was about pharmacokinetic. Now what the drug does to the body, what the drug does to the body. So as I told you, when the drug comes disintegrated, dissoluted, and absorbed from the site of the administration to the blood circulation, then it goes towards its sites of the action. So in the sites of the action, the mechanism of the action occurs. This process is called what? Pharmacodynamic. So this pharmacodynamic, that is according to the mechanisms of the drug actions, can be divided in two groups: stimulating and inhibitors. That is a groups of the drug which enhance the functions of the system, functions of the organ, and we have the groups of the drug which inhibit or suppress the functions of the organ. It was the drugs according to the mechanism of the actions. So according to the size of the actions can be local, general, and reflex. Local, for example, we have drop in the eye, drop in the nose, drop in the ear, local anesthetic. These groups of the drug has the local action. That's why it is called local drug action. So the second one is general. The groups can be according to the actions can be general. This general occurs after the drug absorbed to the blood circulation. Then it can make the general actions of the drug. The last one, it can be reflex types of the drug action can be occurs through the reflex arc. It was the pharmacodynamic. So now let's talk about the pharmacotherapy. Pharmacotherapy, as I told you, it is how to correctly prescribe the medications. So as we know, it can be ethiotropic, pathogenic, symptomatic, and prophylactic. For example, if I'm a doctor, the patients come with the flu. As we know, what is the flu? Flu, it is the viral infection diseases which can be due to the infections of the influenza virus. So now, if ethiotropic, it means the treatments of the diseases according to the what? According to the etiology, according to the causes. So if the patients come with the flu, what is the causes of the flu? It can be influenza. I should to prescribe what? Antiviral drug. Here I cannot prescribe to the patients antibiotic because it can be iatrogenic types of the treatment. It is wrong treatments. The correct treatments can be what? For the viral infection can be antiviral drug. For the bacterial can be antibiotics. It can be the ethiotropic types of the diseases. Second one, pathogenic. It means the treatments of the diseases according to the pathogenesis. As we know, there is the diseases we should know. For example, I will bring you the multiple seizures, which is epilepsy. In the epilepsy, if we know the pathogenesis of the epilepsy, in the epilepsy increase the amounts of the GABA mediated neurotransmitters. decrease the GABA neurotransmitter and increase the glutamate neurotransmitter. As we know, the GABA, it is inhibitory neurotransmitter, but glutamate, it is what? Excitatory neurotransmitter. So now in the epilepsy, when the GABA decreases, the glutamate increases, it can lead to the seizures. So we have the pathogenic treatments. We have the groups of the drug which decrease the glutamate and increase what? GABA. For example, we have the drugs which increase the GABA, benzodiazepine derivative, barbituric acid derivative, lorazepam, diazepam. Later I will discuss about each groups of the drug. Also we have the drugs which what? Decrease the glutamate activity, like what? Sodium valproate, lamotrigine, carbamazepine, and etc. So it was the pathogenic types of the treatment. The third one can be symptomatic. So symptomatic, as I brought you example about the flu. The patients comes with the flu. What is the main symptoms of the flu? It can be fever. It can be what? The main treatments of the viral infection for the flu, it can be what? The main symptoms can be fevers, it can be rhinorrhea. That's why I can treat the patients according to the symptoms. If the patient has the fever, I will prescribe it antipyrogenic, especially acetaminophen, which is paracetamol also known. I will prescribe acetaminophen for the symptomatic. Also, we have prophylactic types of the treatments. Prophylactic, it means we prevent a certain diseases. For example, the patient who has a gout, in order to prevent diseases, the patient must use what? A drug which inhibit the xanthine oxidase inhibitor, like allopurinol or febuxostat. They must, for the prophylactics of the gout attack, the patient who has gout must use that groups of the drug for the preventions. It was about what? General pharmacology. So now let's go about the systemic pharmacology. So systemic pharmacology, it is about the individual drug or the classes of the drug in detail. As we know, there is a groups of the drug which affect mainly in the central nervous system, in the peripheral nervous system, in the respiratory, in the gastrointestinal, in the cardiovascular, in the urinary systems, in the endocrine system, and in the microbes, and etc. So one by one now I will briefly explain you about. So the drugs which acting in the central nervous system and peripheral nervous system. For example, we have the general anesthetic drugs which affect especially in the central nervous system, or we have analgesic drugs which affect in the central nervous system. So we have also drugs which affect in the peripheral nervous systems, especially we have cholinergic drug and adrenergic drug. Can be cholinemimetic, cholinoblocker, adrenomimetic, adenoblocker, the drugs which enhance the functions of the adrenergic neurotransmitter and decrease the adrenergic neurotransmitter. Same things to the cholinergic systems. It was the drugs which affect in the central nervous system and peripheral nervous system. There's another group, the drug which acting in the respiratory system. There is a group of the drug which affect mainly in the respiratory system. For example, we have expectorant or antitussive drug to eliminate expectorant for the wet cough, antitussive for the dry cough. Also, we have the drugs for bronchodilator, the patient who has COPD diseases or asthma disease. We have the drug which is bronchodilator. The another drug which we have drug acting in the gastrointestinal tract. There is a group of the drug which decrease the aggressive factors of the stomach and increase the defensive factors of the stomach in order to prevent or to treat the ulcer diseases of the stomach. So another groups of the drug which affect or acting in the cardiovascular system. As know, the human heart, which is the muscular organs responsible for the pumpings of the blood through all of the human body. If there is any pathological condition like tachyarrhythmia, bradyarrhythmia, or we have hypertension, in this case we have the drug which affect in the heart in order to regulate and eliminate that violation functions of the organ. So after that, we have the drug which acting in the urinary system, especially we have the drug which affect in the kidney or in the nephron, in the renal tubulus, especially the drugs which diuretic drug. We have certain groups of the drug which affect in the kidney. Also drug which affect in the RAS system, that is renin, angiotensin, aldosterone system. Later we will discuss about each of them. So we have the drug acting in the endocrine systems. Insulin, for example, the main drugs for the what prevent or for treat for prevent or for treatments of the what for the diabetic mellitus. So the drugs which acting in the what in the microbes, so we have antibacterial, antiprotozoal, antiviral, and etc. It was all about what pharmacology, systemic pharmacology. Now let's quickly review the topic. As I told you in this video, I will explain you about what? About introductions to the pharmacology. So introduction to the pharmacology. Pharmacology is a science which study about the drug and their actions in the what? In the living organisms. So according to the actions in the living organisms, the pharmacology divided in two major groups: the general pharmacology and what? Systemic pharmacology. General pharmacology it is about the basic principles of the drug actions, but systemic pharmacology is about what? Individuals of the drug or classes of the drug in detail. So the general pharmacology include the pharmacokinetic, pharmacodynamic, and pharmacotherapy. Pharmacokinetic, what does the body, what the body does to drug, and pharmacodynamic, what the drug does to the body. So pharmacotherapy, how to correctly prescribe the medication. I already explained you the stage of the pharmacokinetic. I explained to you about the pharmacodynamic and pharmacotherapeutic. In the systemic pharmacology, we have the drug which affect in the different systems. It was our today's topic. If you find this video helpful, please subscribe me and share this video to your friends.